Hey guys, Adam Richmond here with Athletic Training and Performance. Last week on my blog article, I wrote about neutral spine and how important it is to increase performance and decrease injury risk. Today I want to go a little bit further with that concept and talk about how to incorporate that in the half kneeling hip flexor stretch. I see our athletes butcher this all the time. They're not actually stretching the quadriceps and the psoas like we're trying to in the half kneeling stretch. Instead, they're just hanging out on the front of their anterior capsule and their lower back and just putting stress on the low back. So what it looks like when you do it incorrectly, and what I see a lot of our athletes doing is, so from half kneeling, they're going forward and they're just hanging out here. Normal range of motion for the hip extension is only 10 degrees. So what I just showed you was way more than 10 degrees. So where's that mobility coming from? So realistically, we're just hanging out on that anterior capsule, like I just said, and stressing the lower back. If we think about the tissue that we're actually trying to stretch, which is the quadriceps and the psoas, the quadriceps connect to the front of the pelvis, and when we go into hyperextension, we anteriorly tilt the pelvis and hyperextend the lower back. So the quadriceps that are connected to the front of the pelvis are now in a shortened position, and the psoas that is connected to the lumbar spine is now in a shortened position. So we're not actually stretching the tissue that we think we are. We're actually shortening that tissue instead of lengthening it. So a better way to stretch the hip flexors, the quadriceps, and the psoas is to maintain a neutral spine while doing so and posteriorly tilting the pelvis, which is going to then allow us to actually stretch what we're trying to stretch or mobilize what we're trying to mobilize. So I'm going to show you a technique that I like to do, and that's called using a little bit of reciprocal inhibition. So I like to use a foam roller out in front of me. We're going to put both hands on top of the foam roller and push down. That's going to reflexively give us a little anterior core stability, a little anterior stiffness. By doing so, that's going to prevent us from going into that hyperextension in the lumbar spine. The next thing we're going to do is actually squeeze the glute. I like to cue my athletes to drive their knee into the ground, which will again reflexively squeeze that glute and hopefully posteriorly tilt the pelvis as we maintain a neutral spine, which is going to help isolate the quadriceps and the psoas rather than shortening those muscles when we go into a position like this. So push down real hard with your hands, tighten up the core, get into a neutral spine, squeeze the glute to posteriorly tilt the pelvis, and then we can rock forward just a little bit to get a nice stretch, and then come back, and then do it again, push, squeeze, stretch, and relax. Some people will have a little difficulty if they go into their toes here. Sometimes people will actually tighten up the quadricep as they push down with this back leg, which actually can tighten that up. So if that's the case with you, you can go flat, just put your laces down and stretch. But I think if you can do it without tightening the quadricep and actually get into the toes, that kind of helps get the glute firing a little bit more and get a little bit more posterior tilt. So try it both ways. See what you like, and hopefully you actually feel a better stretch in the front of the thigh where we're trying to feel that stretch. So at half kneeling hip flexor, trying to get it here and not low back and anterior capsule. So make sure you always have a neutral spine with whatever you do, especially mobility or stability exercises. So hopefully this helps you get some mobility in your hip extensors. Thanks.